You probably never thought you'd still have questions about your body at this age. You've lived, you've learned, you've taken care of yourself, or tried to, but something's been bothering you lately, a change you can't quite put your finger on. Maybe it's the way you feel after releasing. Maybe it's the lack of feeling at all. Or maybe it's the quiet fear that what once came naturally might now be working against you. You've asked yourself, could masturbation be harming my prostate, or is it helping? The truth isn't what you've been told, and it's time you finally heard it. You were never really taught how your body changes after 50, not the way you deserved. Sure, there were the basics. Hormones shift, energy drops, check your PSA. But no one ever sat you down and told you the full story, especially about your prostate, especially about self-pleasure, and definitely not about how the two are connected, so you were left to figure it out alone. You kept your habits mostly the same. You didn't ask too many questions, but slowly, quietly, something changed, and now you're wondering if you've missed something important. You see, after 50, your prostate doesn't behave the way it used to. It starts to grow, slowly at first, sometimes without symptoms, but over time, it can press on your bladder, it can affect your urination, it can even impact your sexual function. And when that happens, it's not just your body that suffers, it's your sense of self. You might have noticed more frequent urges to go, a weaker stream, a strange discomfort during release, or maybe it's just the uneasy feeling that you're more disconnected from your pleasure than you used to be. So, you begin to wonder, could it be related to how often I'm masturbating or how I'm doing it? You wouldn't be the first to ask. Men all over the world are quietly asking the same thing, especially as the years go by. You wonder if doing it too often is draining your energy. You worry that abstaining for too long is causing congestion. You hear myths. You hear contradictions. And all the while, you're left guessing. Maybe you stopped masturbating altogether, thinking it was healthier. Maybe you leaned on it as a stress relief, but started to feel shame afterward. Maybe it became a habit, but not a fulfilling one. Either way, it stopped feeling right, and no one ever gave you a clear answer. Until now. Here's the truth that changes everything. It's not about whether you masturbate, it's about how you do it. And when done with awareness and intention, self-pleasure can actually support your prostate health. There's science behind it. Studies show that men who ejaculate regularly, especially more than 21 times a month, have a reduced risk of developing prostate cancer. Why? Because ejaculation flushes the prostate, it improves circulation, it reduces congestion, and it helps regulate hormone balance, especially in the lower pelvis. But the secret isn't just in the numbers, it's in the approach. When you rush, when you grip tightly, when you use overstimulating visuals, or disconnect emotionally, you're not just robbing yourself of pleasure, you're stressing your nervous system, you're reducing blood flow, you're reinforcing tension in the pelvic floor, and that tension, if left unchecked, can impair your prostate health, your erections, and your ability to feel anything at all. You're not broken, you're just out of sync with the version of your body you live in now. And now, it's time to reconnect. So what can you do? Start by slowing down. Set aside time, not to perform, but to be present. Dim the lights, sit or lie down in a comfortable space. Breathe deeply through your nose, letting your belly rise. Exhale slowly through your mouth. Feel your body start to soften. Place your hand on your lower abdomen. Just rest it there. Let yourself arrive. Before you even begin to touch, allow your breath to guide your awareness back to your body. Then begin with gentle, broad strokes, not just on your penis, but around your pelvis, thighs, and perineum. These areas are rich with nerves and vessels connected to the prostate. By massaging them, you're not just waking up sensation, you're improving circulation, reducing inflammation, and supporting detoxification in the pelvic region. Use a light grip. Avoid rapid or repetitive strokes. Focus on rhythm, not friction. Let arousal build naturally. Stay connected to your breath. If you feel tension, pause. Breathe into it. This isn't about rushing to climax. It's about learning how to feel again. And in that space, something remarkable happens. Your sensitivity returns. Your erections improve. Your sleep deepens. Your anxiety lifts. And your body begins to trust you again. Afterward, give yourself a moment of stillness. Place your hand on your heart or belly. Acknowledge yourself, not just for what you did, but for how you did it. You've spent years in silence, years guessing, years wondering if you were helping or hurting your body. But now you know, your prostate doesn't need less attention. It needs the right kind of attention. You're still capable of pleasure, still worthy of connection, still allowed to care for yourself in a way that's nourishing, not shameful. Your body hasn't given up on you. It's been waiting for you to show up differently. Masturbation after 50 isn't a joke. It isn't a habit to hide. It's an opportunity, a tool, a lifeline to your own wellness. When you learn how to do it with care, it becomes more than a release. It becomes a form of healing. So tonight, take that first step, not toward performance, not toward guilt, but toward presence, toward intention, toward the truth of what your body really needs and what you still have to offer it. This isn't about going back, it's about going deeper, and it starts with one breath, one touch, one moment of awareness. Your health is still yours to shape, and the next chapter, it begins now.